All right, Brian from Straight Blast Gym with Ben. We're gonna be working today on some of the rehab stuff. And so I think the easiest tool I have for phase one, I broke down my rehab into 3 phases. The first one is going to be a bunch of non-load bearing work and a bunch of low resistance, low impact work. And so learning to really strengthen the area around the damaged knee. And so I chose the spin bike over the assault bike. I actually personally don't love sitting on this thing for long periods of time. I prefer the assault bike. I think that the Rogue assault bike is awesome for conditioning for athletes that are healthy. But the problem is that the harder I push myself on that bike, the harder it pushes back. So I have a limited amount of work that I can do with that bike. So with this one, I turn the resistance all the way down so that I can use it to spin. And then the other thing I did is I looked up how I should be setting up on the bike so that I'm actually sitting on it properly. So this is something that I didn't really know a ton about. I probably could have asked Brad, my first blue belt, about this because he's a triathlete. But I want to talk about setting up onto a bike. So we're gonna get on here, right? And the thing that they suggested when we set this up, see if I can not hit my knee, there we go, is that when we get onto the bike and we sit on the bike, my heel should set at almost a straight leg at the bottom. So when I go to put my foot in with my toe, I've got a little bit of extra room as I spin through, right? I'm not bottoming out on the bike. So that's the big piece that I took away from this, was to be able to set myself up at a pace or at a distance with my leg so that I'm never bottoming my knee out. The other thing that I found, I was doing this morning, was that I cannot, once I get on the bike and I start spinning, because of the MCL injury, I cannot readjust myself. So get comfortable on the bike first. It hurts for me to move myself while spinning. So that's gonna be another piece for you to think about. And then the suggested time for the first phase in the first couple weeks, the first 28 days, is 15 to 20 minutes of spinning, right? And so what I've done is I've broken this down into 5-minute increments, and I'll just put my phone on the mat, and I will go forward for 5 minutes, and then I will go backwards for 5 minutes, so that I'm getting to work both of those directions. I have found in the past that going backwards as well can be super, super helpful for my legs and for my knees. And the other thing that was suggested or was shown is that you can get away with doing this twice a week or twice a day. So obviously if you're not an athlete, you can go every other day, once a day, and that's fine. If you are an athlete and you're trying not to lose your gains, for lack of a better term, you probably want to put in a little bit more volume, because the intensity is so freakishly low that it's kind of frustrating. And so that's the big thing with this thing. I'm doing 5 minutes forward, 5 minutes backwards, 5 minutes forwards, 5 minutes backwards, directly after my first set of morning classes that I teach for 2 hours, and then directly after my evening classes that I teach. So I jump on the bike, and this is a perfect time for me, because that's when my guys are sparring. I'm able to look at the mat, watch my guys spar, and be able to still get my work in. And so that's gonna be the crux of my kind of conditioning and non-impact based stuff. So thank you guys.